Hujambo. Welcome to this YouTube channel whereby Grace the Nurse talks about mother and child health care. I hope by now you have been able to listen to the other video clips whereby I did an introduction, that is the reason as to why I came into this social media, and we talked about care during birth plan and then care during pregnancy. Today we are going to talk about labor and delivery. We said that when a mother carries a pregnancy, a time comes when this baby will come out, either one or more, depending on what the mother is carrying. So, what is labor? They say that labor is the process during which the baby or babies are, and their content are expelled from the uterus. So, what are the signs of labor? They say that signs of labor usually is the uterine contraction. And this uterine contraction is repetitive. It keeps repeating itself. And as the time goes by, the intensity of the uterine contraction increases. This pain also goes to the back. So you hear a mother who is about to have the baby say that the pain is in the lower abdomen, that is where the uterus is, and the pain is radiating to the back. And it keeps repeating itself. That is why we said last time that a mother is supposed to be ready with a birth plan, so that when these contractions start, the mother is ready to go to a health facility of their choice. Labor undergoes some stages. So which are these stages? There is first stage, there is second stage, and the third stage. The first stage can go up to 12 to 19 hours. The second stage can go from 20 minutes up to 2 hours. Then the third stage can take 5 minutes up to 30 minutes. So what happens between these hours? Remember, in our birth plan we said that you should plan to be assisted by a skilled health worker for a delivery. So we usually encourage mothers, when this labor starts or the contractions starts, they should not delay at all. Sometimes when a mother delays, they come when they are in second stage. And the second stage is when the baby is coming out. In the first stage, the baby is preparing itself to come out. But in second stage, the baby is coming out. That's why sometimes the media reports mothers who are said to have delivered in the reception area, because the mother took time before she went to a health facility of her choice to be assisted during labor. Then, what is delivery? We say that delivery is the end of a pregnancy. A pregnancy is carried for 9 months, but when somebody says one has delivered, it means that the period of carrying a pregnancy has come to an end. There are two ways that a baby can come out of the uterus, either through a normal birth canal delivery or through assistance of a surgeon through an operation. So you see the importance of going to deliver in a health facility? Yes, because the midwife who will be assisting you, or the nurse who is with you, can be able to tell if there are complications that needs intervention of a surgeon. That is the time a mother is prepared and taken to theatre to be assisted to remove the baby. Then, after the baby is born, either through a normal or birth canal delivery or through an operation, there are things to be noted. That is, what are the things to be noted after delivery? Number one, we must note the duration of pregnancy. For how long did you carry your pregnancy? Because we know there are babies who are born either before term or others are born after the term. Term means the period whereby a baby is supposed to be born. So there are preterm babies and there are those who are said to be post-term babies. So those ones, that one is noted. Another thing that is noted is the mode of delivery. So in that small book, booklet that you have, after you undergo the process of labor and you have gone through delivery, these things are supposed to be noted. So which mode of delivery did you get your baby with? Is it through a normal spontaneous delivery or through a cesarean section whereby an operation has been done? Another thing that is noted is the blood loss. How much did the mother lose in terms of blood? Remember, in our birth plan, we had said that a mother is tested the blood and some blood donors is stand by. Why? Because of this time of delivery. Why? Because a mother can lose blood either in light blood, medium blood, or heavy blood. That is, in terms of losing the blood, it can be light, medium, or heavy. In case it is heavy, this is now the time the blood donor comes in. Then another thing that is noted is the condition of the mother. After the mother delivers, what is the condition? Is it a stable condition or the mother has deteriorated in terms of condition? All these ones are noted. So delivery in a health facility is very, very important because this type of delivery is very, very critical. Another thing that we note is the drugs that we administer after delivery. Most of the times, the only drug that we give, if there is no other complication, is drug to minimize the blood loss for a mother. But in case it develops complications, again, as I've said, a doctor is informed and some other medications are prescribed to boost the health condition of a mother. For the baby, if it is in a stable condition also, the only medicine that we put is the medicine we call tetracycline eye ointment. What we do, we put some medicine in the eyes. Why? Because remember we said the baby is being born through a normal process, whereby it passes through the normal birth canal, and in case it sweeps out like this and comes out with some infection, the eyes are going to be the first to be affected. So we put the tetracycline eye ointment. Another drug that is listed to be given to a baby is in case a baby is exposed. You know what we say, the status of a mother. If is born by a HIV positive mother, the baby is exposed to, has risk of contacting the disease. So the baby is given the medicine to prevent the infection. The medicine is the ARV, which is usually given in the clinic where the mother has been getting the medicines. Then another thing we usually notice, the place of delivery. Where did the mother deliver the baby? Is it in a health facility or at home? Remember what we talked about labor. We said labor goes through 3 stages. Imagine if a mother is delivering at home and the person who is assisting you doesn't understand about these 3 stages of labor. She doesn't know what to observe. That is why we encourage mothers to be in a health facility whereby there is a team which can be called immediately a complication is noted. So on your health booklet, we always write the place of delivery. Another thing that we note is the birth attendant who assisted you in the delivery. Yes, most of the times it's a team of people, but the only person who we note is the person who assisted you in the delivery. Is it a midwife? Is it a doctor? Is it a clinical officer? Or who is it as far as it's a skilled health person? Other things that are noted is after the mother has rested for some time in the ward, the baby is also given a notification. All babies who are born in health facilities are given birth notification. And these notifications are the ones which later assist the mother to get the birth certificate of the child. Then lastly, but not least, is the immunization. The baby is given immunization. There are those 2 immunizations which are given to the baby as first doses immediately the baby is born. As we continue with this series, we will also talk about immunizations in details. But generally, that is how we attend mother when she comes into the maternity for delivery. So what have we talked about today? What have you learned as a participant? Can you be able now to describe labor? Can you tell the signs of labor? Are you able to list the stages of labor? Can you describe delivery? And are you able to list the things that are noted after delivery? All these things happen in the hospital, and now with this COVID era, mothers have absconded hospitals. But remember, all what happens there is for saving life. And that's why we have taken this social media to be able to pass the information to the mothers and tell them the importance of visiting a health facility of your choice immediately you realize that you are going into labor. Don't delay. Don't wait until you go to get your baby in the reception area. Come early in the first stage when you realize that you're having those repetitive uterine contractions and the pain is radiating to the back. Don't forget to subscribe on my Grace the Nurse YouTube channel. Ask questions and you'll be answered. Thank you.